Good evening. Thank you for joining me in today's town hall. My name is Rebecca, and I will be walking us through a high-level overview of Sutter Health's financial performance in 2023. The goal of this presentation is to look at where we stand financially, understand the key drivers behind our results, and share a targeted financial plan that supports the ongoing stability and growth of our organization. We will also take a step back to connect the dots between healthcare economics and our real world operations here at Sutter Health so that we can see how our decisions today shape both short term performance and long term sustainability. As we get started, I wanted to set the stage for why we are here today. The purpose of this presentation is to give everyone a clear picture of Sutter Health's financial position and to talk about how healthcare economics helps us make smarter financial and operational decisions. Financial health is important in healthcare, not just for keeping the lights on, but for making sure we invest in our people, expand access for patients, and continue serving communities. When we think about economics and healthcare, it's not just about numbers on a page. It's about understanding how costs, revenue streams, policies, and even supply and demand shape the choices we make. These economic factors directly affect how we plan, how we grow, and how we deliver quality care. Before we look at the numbers, let's take a step back and look at who Sutter Health is as an organization. In 2023, we served about 3.4 million patients across Northern California. That's a huge reach, and it shows just how central Sutter Health is to the communities we serve. Financially, our operating revenue reached 15.8 billion, which puts us among the top 10 not-for-profit health systems in the country. Behind those numbers are people. More than 57,000 employees, including 15,000 nurses and over 12,000 physicians spread across 8 medical groups. This scale is both a strength and a responsibility. What this snapshot really shows is that Sutter Health is a major player in California's healthcare landscape, and our financial decisions impact millions of lives, not just patients, but employees and communities as well. Now that we have a snapshot of the organization, let's look at the financial side and where we stand today. In 2023, our operating income was three 320 million, which represents an operating margin of about 2%. While that may seem modest, it is typical for large nonprofit health systems balancing patient care with community responsibilities. Net income came in at 1.17 billion. A significant of this comes from non-operating sources such as investments, which help us maintain long-term financial stability. Community benefits remain a core part of Saturn's mission. In 2023, we invested 822 million in charity care, education, research, and programs that address social determinants of health. We also focused on growth and sustainability. Capital investments over 800 million were planned for Capital investments over 800 million are planned for ambulatory expansion, facility updates, and technology improvements. These investments not only enhance patient care, but also help us manage costs more efficiently in the long run. Overall, these numbers show that Sutter Health is financially stable, but, but, but must continuously balance operating revenue, community commitments, and long-term investments. These numbers tell us where we are right now, but what's even more important is understanding how those results have been trending over time. Here we can see some of the key financial performance trends at Sutter Health. Revenue increased in 2023, largely due to higher patient volumes and expanded services across our system. However, expenses also grew, especially in labor costs and medical supplies, two areas that are heavily affected by inflation and workforce shortages. Even with these pressures, Sutter Health improved its operating margin compared to 2022, showing better efficiency in operations. This improvement, while modest, indicates strong management of resources. It is also worth noting that non operating gains, mainly from investment returns, significantly boosted our overall net income. While these gains are important, they can fluctuate year to year, which is why strong operational performance is crucial for long term stability. So overall, the trend is encouraging. We are moving in the right direction, but we must keep a close eye on cost control while continuing to expand access to care. To better understand these results, we need to break down costs, both the immediate short run costs of running the system and the long term investments that sustain it. In the short run, Sutter Health has to deal with costs that cannot really be changed quickly. These are things like rent for facilities, staff salaries, and utilities, the expenses that stay consistent no matter how many patients we see. On top of that, there are variable costs, such as medical supplies or overtime pay for staff, which shift depending on patient demand. In the long run, however, costs look a little different. Sutter Health makes strategic decisions about expanding facilities, investing in new technologies like electronic health records or AI driven tools, and strengthening its workforce through training programs. These are big picture investments that may be expensive upfront, but they are designed to reduce costs and improve care over time. For example, the 2023 report highlights investments in digital innovation and partnerships, which are long term strategies to keep the organization financially sustainable. So, when we think about financial planning, we need to balance both perspectives, managing short run costs carefully to stay efficient, while also investing in long run strategies to make sure the system is strong and resilient for years to come. Of course, Sutter Health does not operate in isolation. Because of its size, it benefits from economies of scale, which help offset some of these costs. Here we see how Sutter Health's size and structure create economies of scale. At the center of our system are 8 medical groups, which form the foundation of how we deliver coordinated care. First, we benefit from shared resources, which include everything from clinical programs to staffing to administrative support. By pooling across multiple medical groups, we reduce duplication and increase efficiency. Second, we leverage bulk purchasing power. When 8 groups join forces, we can negotiate better prices for supplies, equipment, and services. This drives down costs and allows us to reinvest savings into patient care. The third, we operate with centralized systems. Our electronic health records, billing processes, and digital tools are standardized across the network, which helps improve both efficiency and the patient experience. These advantages together allow Sutter Health to deliver high quality care while keeping costs manageable, something that is only possible because of the scale we have built across our 8 medical groups. Even with those advantages, cost containment is always a priority. Here are some of the key strategic Sutter Here are some of the key strategies Sutter Health uses is to manage expenses efficiently. One key approach is standardizing clinical protocols by making sure that care teams across all 8 medical groups follow evidence based practices. We reduce unnecessary variation in treatment, which improves outcomes and lowers costs. We also emphasize preventative care and chronic disease management. Programs targeting conditions like diabetes, hypertension, and heart disease not only improve patients' lives but also help avoid costly hospitalizations and emergency visits. Another strategy is our investment in digital health, telemedicine, patient portals, and electronic health records streamline care delivery, cut down on redundancies, and make access more convenient for patients. Finally, Sutter Health participates in value based care initiatives where reimbursement is tied to patient outcomes instead of the volume of services. This encourages efficiency, coordination, and accountability across our networks. Together, these strategies highlight Sutter Health's commitment to balancing cost control with high quality patient centered care. But being financially strong is not just about the bottom line. Sutter Health reinvests heavily into its communities to address broader public health needs. Now, let's take a look at how Sutter Health engages with the communities it serves. In 2023, Sutter invested more than 872 million in community benefit programs. This includes providing charity care and covering costs for patients with Medi-Cal who often face challenges accessing healthcare. At Sutter Health, but Sutter Health goes beyond just clinical care. They actively partner with community organizations to tackle bigger public health issues like mental health support, housing stability, and food insecurity. These are areas we know directly impact health outcomes. Another key priority is health equity, making sure underserved communities and vulnerable populations receive the resources and care they need. By addressing these social determinants of health, Sutter Health works towards improving not just individual patient outcomes, but overall community well being. While these community investments are important, they also create challenges, especially when combined with rising costs and workforce shortages. While Sutter is doing a lot of great work, like any large health system, it faces some significant challenges. One of the biggest issues is rising operational costs. Healthcare delivery has become increasingly expensive, especially with the higher cost of staffing, medical supplies, and new technologies. Another challenge is workforce shortages. Like many health systems across the country, Sutter struggles to recruit and retain enough healthcare professionals, which puts pressure on patient care and staff morale. Additionally, reimbursement rates from Medicare and Medi-Cal often do not fully cover the cost of providing care. This creates a financial strain, particularly since Sutter serves many patients under these programs. The organization must consistently work to balance its mission of providing quality, community focused care with the need to remain financially sustainable in a very complex healthcare environment. One way to visualize these economic forces is through the supply curve, which helps us see how costs and services shift on key factors. This slide shows a basic healthcare supply curve, which represents the relationship between the quantity of services provided and the cost of delivering those services. For Sutter Health, several factors can shift this curve. Workforce availability is a major one. When there are staffing shortages, it reduces our ability to supply services, effectively shifting the curve to the left. On the other hand, technology investments like electronic health records, digital scheduling, all AI based tools can increase efficiency and expand capacity, shifting the curve to the right. Finally, reimbursement rates and policy changes also influence supply. If payments are too low, it reduces the incentive to provide certain services. But if policies support reimbursement or funding, it can expand our supply of care. Understanding how these factors move the supply curve helps us see the bigger economic picture and make informed decisions about financial planning. Now that we have reviewed Sutter's financial position, performance, and challenges, let's look at the financial plan to support long term viability. In the short term, we need to focus on controlling supply of labor costs, which are some of our biggest expenses. Expanding digital health solutions such as telemedicine and patient portals helps us become more efficient while improving patient access. Strengthening our payer mix and negotiating smarter contracts with insurers also makes sure we stabilize revenue. Looking at the long term, Sutter is already making big investments, like the 800 million expansion of ambulatory care centers across Northern California. We are also growing our residency programs, which will help solve workforce shortages by training the next generation of providers within our system. Innovation is another key piece. Integrating AI, improving our electronic health records, and forming research partnerships keeps us competitive and forward thinking. Finally, increasing community health investments not only supports our mission, but also reduces long term costs by keeping populations healthier. Together, these strategies can create a roadmap for balancing immediate needs with long term sustainability, making sure Sutter Health can continue serving millions of patients while remaining financially strong. As we wrap up, let's bring everything together. Sutter Health is in a strong financial position with steady revenue growth and significant community investments. At the same time, we face real challenges, including rising costs, workforce shortages, and reimbursement pressures from government programs. The key takeaway is balance. By carefully managing short run efficiencies, things like cost control and digital health, while also making long run investments in facilities, technology, and workforce development, Sutter is building a path towards sustainable success. And perhaps most importantly, the organization continues to put community health at the center of its strategy. That focus not only supports our mission as a nonprofit, but it also creates long term financial stability by improving population health outcomes. In short, Sutter Health is positioned to remain both financially viable and community focused well into the future.